Hello, welcome back, future nurse. Um, I'm glad that you are back in this video lecture, and I hope you are learning something in this video lecture series. I know you are, and thank you for supporting, thank you for subscribing. Continue to be notified for more nursing and education video lectures together with inspirational and faith and prayer videos later on. So, to continue this video lecture series on communicable and infectious diseases, we are going to present one of the most common endemic diseases here in the Philippines. It's really now considered to be an endemic disease. It's a vector-borne disease. This is dengue. Okay, so dengue is otherwise known as dandy fever in other countries, or breakbone fever. This is common in tropical areas, and it has different strains of virus. Again, it's a virus, and this is transmitted by mosquitoes, also known in the Philippines, Thailand, Singapore, as hemorrhagic fever or H fever. Uh, Years ago, maybe more than a decade ago, it's called H fever. And occasionally, it's also called acute infectious thrombocytopenic purpura, because one of its effects is it decreases platelets. Okay? And purpura because of its characteristic sign of Hermann's, called Hermann's sign, which produces pinpoint rashes. So the etiology and the causative agent is either a flavivirus or arbovirus with serotypes dengue virus 1, 2, 3, and 4. And based on one resource, its incubation period is 3 to 14 days. Again, reminder, suggesting that you read multiple resources and choose the best answer on examinations or the average. A dengue virus or dengue fever is characterized by fever, rash, muscle, and joint pains usually, and the vector rather is the Aedes aegypti mosquito. A female Aedes aegypti mosquito. Okay, so on close image, this is how it looks like. It is characterized by the white stripes on the legs of the mosquito. Okay, so vectors are either Aedes aegypti, Aedes albopictus, or Culex fatigans, but on prints, on references, the most common one is Aedes aegypti, a female Aedes aegypti mosquito. Characteristics of Aedes aegypti, because this is also commonly disseminated. The mosquito is said to be a low-flying, a day-biting mosquito. Usually breeds on stagnant water, meaning non-running water. Non-running water. Common in urban areas, has white stripes on the legs, as shown earlier in the image, gray wings, and lands on water in a parallel position with two hind legs raised. Then we have again another incubation period, 6 days to 1 week. Manifestations of this dengue fever or dengue is usually classified into grading, classified into stages also. Usually the higher the grade, the higher the stage is, it's more, let's say, dangerous. Okay, let's discuss it. Okay, for grade 1 manifestations, the patient may have high grade fever, 3 to 5 days. It's usually intermittent, and the patient may feel headaches, periorbital pain, joint and bone pain, abdominal pain, nausea and vomiting, petechial formation or the petechiae rash, um, and Hermann's sign, which is accompanied by generalized flashing of the skin. Okay, so this is the image of the rashes, the Hermann's sign on dengue patients. That's the petechial rash. It is described usually as pinpoint rashes. If the patient is on grade 2, classified as grade 2, the signs and symptoms of grade 1 plus bleeding. Okay, any signs of bleeding, that's grade 2. Okay, dengue grade 2. So, any type of bleeding, examples are epistaxis or nose bleeding, GI bleeding being manifested by melena or hematochezia, or even say vomitus with blood, okay, and gum bleeding. Okay, so since we're talking about blood or bleeding, the circulation of the patient can be assessed also. One way, simple way to assess it, test it, is the capillary refill time. So as you can see here, the on the image, capillary refill is about 6 seconds and does not yet reach its normal color or normal circulation. Okay, and we know that it's usually less than 2 seconds. Okay, some graphics. So I was referring to the picture that any age can be affected by dengue. Usually, it is one of the misconception is it's only for children. No, so any regardless of age, dengue can be experienced. Grade 3 manifestations are manifestations of grade 2 plus circulatory failure, okay, or circulatory collapse. Uh, Some of the manifestations are cold, clammy skin, altered vital signs already, decreased blood pressure, rapid rate pulse, increased respiration. So, and these vital signs are suggesting an impending by hypovolemic shock. Okay, so why bleeding is at risk for these patients? Because as I've mentioned earlier, um, the virus destroys platelets. Okay, and we know that one of the functions of platelets is the clotting action. Okay, clot the blood. So if the platelet level is decreased, okay, some patients may experience really way below, okay, a single digit numbers. Okay, what I mean is when you ask them, they will only tell you a figure that can signify it's too low. It's usually how they say it, right? The platelet level, um, and when you have below normal, of course, or way below normal platelet levels, you are at risk for bleeding because you have no clotting actions already. So that's the cause of bleeding. Okay, and we are going to tackle that more later on the succeeding presentation or slides. Okay, grade 4 is grade 3 plus already the presence of hypovolemic shock. So again, when we say hypovolemic shock, it's caused by decreased significant decrease of fluids. Okay, one of which is blood in the body. This one are clinical manifestations based on stages. This is one that is, I think, if also very important to know, because it is usually with the duration of the days of the disease. Okay, so usually a febrile or invasive stage manifestations are happening within 2 to 7 days, and these are high grade fever, headache, body malaise, conjunctival pain, then vomiting, epistaxis can happen, gum bleeding can happen, positive tourniquet test can happen also, or is one of not really confirmatory but screening test done. Okay, tourniquet test or tourniquet with other pronunciation. Uh, with positive tourniquet test, there will be it's a sign of mild hemorrhagic manifestation. Okay, like the pedicay and mucosal membrane bleeding may be seen. So how do you do tourniquet test? You just tie it above your antecubital fossa. Okay, then for five, this I think 5 minutes if I'm not mistaken. Then after that, release it and look at the antecubital fossa and imagine a 1 square inch in your antecubital fossa with 20 to 25 petechiae. Okay, because those presence of petechiae suggests again mild hemorrhagic manifestations. Then for the second um, phase or stage, this is the critical one. Phase when patient can either improve or deteriorate, and the effervescence occurs between 3 to 7 days of illness. Excuse. And those who will improve after the effervescence will be categorized as dengue without warning signs, and those who will deteriorate will manifest warning signs, and this will be categorized as dengue with warning signs, or some may progress to severe dengue. Just to bring up, this is the manifestation phases presented by DOH in their website about dengue control program. When warning signs occurs, severe dengue may follow near the time of the effervescence, and usually it happens between 24 to 48 hours, or 2 days. When you say the effervescence, usually this is known as the period when in which the body temperature drops to almost normal. Okay, usually it's 37.5 to 38 degrees. Okay, if the when the fever decrease or the temperature goes to almost normal, this is where the complication of dengue actually is expected to come out. Okay, as manifested by abdominal pains, signs of bleeding, usually melena, if you're familiar, it's a bleeding in the stool that is usually indicating upper GI bleeding, and unstable BP, narrow pulse pressure, and also shock. Okay, so those this is a graphic one, but I'm trying to show you the sign of bleeding, internal bleeding that can be manifested through this like ecchymotic picture. Then diagnostic tests, again, as I have mentioned, tourniquet test or Rumpel leads test. If you don't have any tourniquet, you can use your pubic cuff, blood pressure cuff. Um, you what's this? You get the blood pressure of the suspected patient, then get the systolic and the diastolic. You add it, divide it by 2. Then you reinflate the cuff on that quotient. Then let it stay for 5 to 10 minutes. Then it is positive again. If you then release it after 5 to 10 minutes, then the tourniquet is positive, tourniquet test is positive, excuse me, or the Rumpel leads test is positive if there is more than 20 petty case or pinpoint rashes formation in 1 square inch, as I've mentioned earlier. Then, of course, platelet count and hematocrit is also one of the best diagnostic procedures. And platelet count is usually decreased with elevated hematocrit. Based on DOH, these are the diagnostic tests: complete blood count with the bleeding parameters, serologic test, dengue blood, dengue IgM. Others are your prothrombin time, activated partial thromboplastin time, bleeding time, and coagulation time. But for the sake of this visual lecture, I will not be focusing on the different laboratories. I suggest that you read them in another uh, source, or I'll be putting up another video lecture for this, but I will be presenting it the way the DOH have discussed it in their website. For dengue and SRDT, it is usually requested between 1 to 5 days of illness, and is used to detect dengue virus antigen during early phase of acute dengue infection. The test is for free in all health centers and selected public hospitals nationwide. For your dengue IgM or IgG, it is requested beyond 5 days of illness, and so it is very good to do history taking, a very good history taking, for you to know, to have a good assessment and to have a good diagnostic test done to your patient. Used to detect dengue antibodies during acute late stage of dengue infection and to determine previous infection. So it's more of detecting the antibodies already that the body have produced against dengue virus. It may give false positive result due to antibodies induced by dengue vaccine. If ever the patient acquired dengue vaccine popularized by Dengvaxia. Okay, it may cross-react with other arboviral diseases such as chikungunya and Zika virus. Okay, so these are different. Okay, remember, these are different diseases from dengue, although they may look similar. Okay, DH augmentation is limited to selected government hospitals only. Then third is your PCR, or your polymerase chain reaction. I know you are familiar with this because of the pandemic. It's one of the gold standard laboratory tests to confirm dengue virus. It's molecularly based test and one of the confirmatory tests also. It's available only in dengue subnational and national reference laboratories. So it's seldomly used for those areas or in the entire Philippines because only select facilities have this type of diagnostic test. Then we have also nucleic acid amplification test, or your loop mediated isothermal amplification assay, or your NAT-LAMP. This is a novel molecular based confirmatory test used to detect dengue virus. So, when you say novel, it's something that is new, if depending on when it was published. It works like just like PCR but cheaper and simpler in nature. In the pipeline to be introduced under the National Dengue Prevention and Control Program in district and provincial hospitals. You have PRNT, or your plaque reduction neutralization test. It's a gold standard also to characterize and quantify circulating level of anti-dengue virus neutralizing antibodies. Okay, available only at the Dengue National Reference Laboratory. And I think this is the last one, similar with the diagnostic test that I've presented. Other tests is or are white blood cell count, platelet, hematocrit. Okay, look for the trend of decreasing WBC, decreasing platelet, and increasing hematocrit. Okay, if this is your diagnostic test, you should remember that. Okay, that the trend is decreasing WBC, decreasing platelet, and increasing hematocrit. Management of dengue patients according to the Department of Health Philippines. We have Group A. These are patients who may be sent home. These are patients who are able to tolerate adequate volumes of oral fluids, so they won't be having problems with dehydration. Pass urine every 6 hours, meaning there are no signs of severe dehydration. Do not have any of the warning signs, particularly when the fever subsides, as being mentioned earlier, and have stable hematocrit. For Group B, these are patients who should be referred for in-hospital management. These patients shall be referred immediately to in-hospital management if they have the following conditions. They have the warning signs, especially the presence of bleeding. These patients without warning signs but with coexisting conditions that may make dengue or its management more complicated. Social circumstances such as living alone or living far from the facility or without reliable means of transportation. So let's say there may be a chance that the condition worsens, but the patient lives in a far area, so it's better to keep them in the facility and observe them. The referring facility has no capability to manage dengue with warning signs or severe dengue. Okay, that's one of the conditions. And when we say coexisting conditions, this can be, for example, pregnancy, old age, infancy, the comorbidities like diabetes mellitus, hypertension, heart failure, kidney diseases, even obesity. Okay, and other autoimmune diseases. And if you are familiar with sickle cell anemia, that's also a condition for coexisting problems. For Group C, these patients with severe dengue requiring emergency treatment and urgent referral. Okay, so these are patients with severe dengue who require emergency treatment and urgent referral because they are in the critical phase of the disease and have the following. Their plasma leakage is severe that can lead to dengue shock, and fluid accumulation is happening with respiratory distress. The patient has severe hemorrhage, severe bleeding, and organs are already affected. Example, the liver can be affected. There is hepatic damage. There is kidney impairment. There is cardiomyopathy. There is encephalitis for the brain. And usually patients in Group C shall be immediately referred and admitted in the hospital within 24 hours. Okay, again, time is of the essence. Okay, for the treatment and other treatment and management, since dengue patients are prone for bleeding, it is not okay. It is emphasized in the screen that aspirin should not be given. Okay, because one of the actions of aspirin, though it's antipyretic, it is anti-clotting. Okay, actions. It has anti-clotting actions. So if it's anti-clotting factors or actions, the more that the patient will bleed. Okay, so give paracetamol. And if there is signs of bleeding, you anticipate the vitamin K or coagulants will be ordered and administered for larger amounts of blood loss. Transfusion may be indicated, but generally, there's no drug of choice, and supportive symptomatic care is usually the regimen. Um, One additional emphasis is to prevent bleeding or correct bleeding if it's already happening, and manage shock or prevent shock from happening. Again, priority here is to prevent and control the bleeding. Okay, you may use ice chips, cold gargles, ice compress. When if it's in the GIT, you can place it in the what's this? You can place it in the abdomen. If it's in the nose bleeding, place in the forehead. Okay, so speaking of bleeding, hematemesis is in the vomitus. So ice pack is over the epigastric area and maintain NPO for episodes of bleeding by hematemesis. Melena, okay, blood in the stool, usually advise them to avoid dark colored foods to avoid misdiagnosis. Okay, so for us not to confuse ourselves whether it's the color of the food they have eaten, it's advisable that they should avoid or not to eat or drink dark colored foods and drinks. Okay, or foods. Okay, then adequate nutrition and then also rest. Okay, prevention is eradication of mosquito. Okay, through the clean technique. So speaking of mosquito, and I have mentioned earlier that there should be good history taking. So you may ask if the patient has been bitten by a mosquito. Okay, and especially if there are possible breeding sites in their places. Okay, this the Department of Health advocates this and emphasize this action, the 4S for the control of dengue. For first S is seek and destroy breeding places. Okay, seek and destroy breeding places. Usually, as I've presented, breeding places are those containers with stagnant waters. Okay, say no to indiscriminate fogging. So, fogging to drive away the mosquitoes should be done with prior deliberation. Okay, it should be thought very well. Then seek early consultation if ever you suspect that you have or your family member have dengue, especially if it was led from factors related to dengue. Then seek early consultation. Then self-protection. Okay, self-protection. If you remember the clean technique, CLEAN, that we have discussed from our to our previous videos. C is chemically treated mosquito nets. L is larvae eating fish. E is environmental sanitation or clean up. A is anti-mosquito soap, and N is the plant neem tree. Okay, which is believed to have mosquito repellent properties. So another category, okay, for dengue. Dengue case classification and level of severity. Dengue illness is categorized according to level of severity as dengue without warning signs, dengue with warning signs, and severe dengue. Okay, as I've mentioned earlier. Dengue without warning signs can be further classified as according to signs and symptoms, laboratory tests, a suspect dengue, probable dengue, and confirmed dengue. Okay, so it's either the patient is suspect, probable, and or confirmed dengue. So first is dengue without warning signs. It is a suspected dengue case. Okay, so previously well individual with acute febrile illness of 1 to 7 days, duration plus 2 of the following: headache, body malaise, retroorbital pain, myalgia, arthralgia, anorexia, nausea, vomiting, diarrhea, flash skin or rash on the petechial, and the presence of Hermann's sign. It is probable if the suspect case plus laboratory test of dengue NS1 antigen test and at least CBC or dengue IgM antibody test, which is considered optional by the Department of Health. Then confirm dengue if a suspect or probable dengue case with positive result of viral culture and or PCR or the NAT LAMP test or even PRNT test. Okay, so these classifications were provided by the Department of Health, Philippines. So either you are dengue suspect case, dengue probable case, or dengue confirmed case. So aside from the patient's manifestation, it's important that they should submit themselves to diagnostic procedures. And last of this presentation, severe dengue. Okay, um, severe dengue has manifestations of severe plasma leakage leading to shock, okay, fluid accumulation with respiratory distress, severe bleeding, and this should be evaluated by a physician, and severe organ impairment also, like your liver, CNS, the heart, and other organs. So it is our duty, okay, as future healthcare providers to teach the public with these different manifestations of the diseases that we are studying. Um, Remember, one of our roles and responsibilities, or two of our roles and responsibilities, is to be an advocate to your clients and be an educator, a health educator to our clients. What you're learning right now is reflected when you apply it in your society. What can you contribute to your society later on? So this is all about dengue, hemorrhagic fever, or dengue. I hope you learned something. I hope you're also taking down notes. If ever you can still watch this over and over. So this is your email. Thank you for subscribing in the channel, and thank you for interacting also through our comment section. And see you on the next video lecture. Thank you, future nurse.